Happy Friday, everyone. Tama Kotorich here. I figured that instead of writing a large report, we've had a tremendously busy week trying to prepare not only for AROC, but many reports that are due, including our ACCME accreditation that we had the honor of obtaining 4 years until end of 2023. I figured it would be nice to just give everyone a little update via video instead of a long written report. So obviously you have seen the first announcement of our keynote speaker for AROC 2021. I know some of you are disappointed it's virtual. We are too. I mean, it's really hard to believe that it's going to be 2 years since we have seen many of you. And I guess it's going to be 3 years before we all get together again, which is very hard to fathom. But you have probably seen some of the reports that I have sent out through LinkedIn. I'm getting a lot of phone calls and messages about them. Wall Street Journal does an amazing job with posting where each state is in terms of their vaccination program and the progression on a daily basis. So I've been posting the statistics on NJAOPS' Instagram page and on LinkedIn for NJAOPS and Facebook, along with my LinkedIn, Instagram, and not so much Facebook. But hopefully you are following along. We have been using social media connect with so many of you. So thank you for following along. Believe it or not, NJAOPS now has almost 1,200 followers on all of our platforms, which is quite exciting. And I know we have been reaching many of you, so we appreciate it. AROC is coming along very well. Like I said, you probably have heard and seen our keynote speaker with Dr. Laura Seiler. She's really going to focus on, and we are going to focus on, this whole physician burnout. I mean, what does it really mean? You know, every association, every entity has a different interpretation. So we figured, why don't we provide you with the tools that you need to pretty much survive your workday? One of the biggest issues that we see in healthcare are the EHR systems, you know, the endless amount of paperwork that you need to fill out. So we're really going to focus on creativity, how to learn to manage and juggle all the stressors that you are encountering every single day. We're going to start every morning with a 1-hour yoga session that's going to progress. So not every day is going to be the same, which means that you're going to start off feeling refreshed before you sit through an 8-hour day with all the educational lectures that we're going to be offering. And unfortunately, after speaking with many physicians, after speaking with physicians in hospital settings, it became quite clear, because of the pandemic, because of the shutdowns that happened in this state and the country, now we are seeing patients coming to cancer centers with stage 3 cancer, where it could have been easily treated and preventable at the early stages. So we're really focusing this AROC on cancer care, as well as on many other public health topics, including COVID and COVID vaccinations. I mean, we're going to bring the Deputy Health Commissioner to talk about COVID-19 and the state's process right now where it happened, including a huge talk on Wednesday after our opening session at 10:30 on COVID-19 vaccinations, where we are, what it means, and how it actually even works, so that hopefully everyone can share this sentiment and the knowledge with their patients. But one of the biggest topics that we have heard was cancer diagnoses. I had the pleasure of connecting with several oncologists at Fox Chase Cancer Center that will be speaking at AROC on Friday afternoon. And as I was on this call last Friday, the oncologist there for GI told me that he just diagnosed 3 young people, ages 37 and 2 that were 38, with colon cancer. I had a breast cancer physician tell me that 3 young women, 27, 28, and 29, just last week alone were diagnosed with breast cancer, and they were all stage 3 for colon cancer and much progression towards stage 3 for breast cancer. But that becomes very concerning, especially for an association that is here to close gaps in care. So we're going to provide a lot of topics on cancer care this year from many physicians that we have not had ever present at our conference. So we're really, really excited to bring that to you. I also had an amazing lecture / conversation call with our New Jersey Pharma bi-weekly COVID-19 phone call that we normally have. And, you know, one of the things that keeps kind of coming back and being reiterated is just how many drugs are still on FDA's list that are on back order, that we don't have enough. So I'll provide you with an updated list, but please keep an eye out on it. The FDA now does provide information on that list that we usually send out to you if there's not enough of that drug in the United States. When it comes back into full production, it kind of gives an update that, okay, we're no longer on that critical list, and it moves it along. So we really hope that you are enjoying our updates, and sometimes I feel bad with blasting you with so many, but I know this week Lori is really focusing on some critical topics. A lot has happened, especially from Governor Murphy with his budget address. Even this morning, I had an amazing call with Senator Vitale and Assemblyman and Chair of the Health Committee, Dr. Conway. They were really focusing on some of the topics, including vaccinations. But right now, one of the other topics that we really haven't talked about is mental health and behavioral health that has really become center of this pandemic. We have seen and heard about, unfortunately, many individuals, including now children, committing suicide. And I'm happy to report that we will have a physician discussing teen suicides, depression, cutting, things that we're seeing in the mainstream on the internet, unfortunately. So we will try to bring that topic to you as well. But there's a lot to talk about, a long way to go. We are releasing our preliminary ARAC schedule today, and it's going to keep building on an ongoing basis as we fulfill some of the requirements for you. But don't forget, June 30th is the last day that you can fulfill or take your CME credits for this licensing cycle before the new one takes in effect in the state of New Jersey. And the AOA and your specialty colleges end December 31st. So please use the list as your guide as to how many CME lectures you need. That can be found on our website, NJAOPS.com, under ARAC 2021, or under the American Osteopathic Association's website. And it breaks it down based on specialty colleges. So we have that link on our website as well. But I hope everyone can take this weekend off to rejuvenate. I know many of you are have been extremely busy because of COVID and everything else going along. So I really hope you take some time for yourself and your family. And if you need us, we're here. Like I said last week, the best way to reach us right now is via email. Our phones have been unbelievably busy, and we're very thankful for that. But I just don't want you to think that we're ignoring you, which we are not. We are diligently going through all the phone calls and emails, so we will get back to you as soon as we can. Otherwise, I hope you have a wonderful weekend. Stay well, stay healthy, and we will talk to you next week with another set of updates for Wednesday and Friday. But I wanted to let you know, keep a special eye out on NJ.com. We have a special announcement, which will be in our update today, surrounding a big PR release that we did when we partnered up with NJ.com, teaching regular citizens in the state of New Jersey about osteopathic medicine and highlighting all the accomplishments in these last 120 years that we've had. So hopefully you're going to like it. Please share it with your patients. It really explains what a DO is and what osteopathic principles really focus on. And I hope you're proud. So one of the call to actions was for these individuals who are reading the article to seek out a DO and to learn more about you. So that's why we exist. That's why we've been working hard this week and perhaps not being able to reach every single one of you via telephone, but I'm very proud of this. I hope you are too. So until next time, wishing you great health, lots of happiness, and I'll talk to you next Friday again. Have a great day. Thank you.